And this morning we had a huge discussion on ketones and cancer. So there are lots of research already, and it's very useful, especially if the patient is cachetic and if he's losing muscle mass. And it also helps in the treatment of several types of cancer, including brain cancer, which is the type of cancer where we have much more research already. And the panelists, the speakers, talked about the importance of tracking ketone index for these patients. And regarding that, the ketone index, patients to have to be more keto adapted and to have more therapeutic effects of the ketogenic diet should maintain this glucose ketone index between 1 and 4. So it's typical in the population that eat lots of carbs to have a GKI, glucose ketone index, between 35 and 50. Can you imagine that? 35 and 50. And in a low carb diet, it's typical for people to be around 6.6. And in a strict ketogenic diet, especially a 4-to-1 ketogenic diet, the GKI is around 1. But for patients with cancer doing the ketogenic diet, the goal would be to be between 1 and 2. So always ask your patients to track the GKI, so they will need a dual monitor that measures glucose levels and ketone levels, and that's very important. And they also talked about several other mechanisms that we should be considering, such as reducing glutamine in the blood. So there are strategies to do that, such as fasting, such as exercise. There are medications that are drugs that reduce glutamine in the blood, and high glutamine is related to a worse cancer outcome. And there are some supplements as well that we might consider talking in another video. Bye bye. Have a nice day.